We've been told it should be coming, the vaccine that is, in about 4 or 5 months. So exactly how much quicker are you asking for it to come?
We think plans can be accelerated and must be accelerated. I mean, let's look at the context we're facing. South Africa is one of the most adversely affected countries in the world. We have a reported estimated 60,000 deaths to date when you look at excess deaths. And that figure will, this time next year, will be something in the region of an additional 200,000 deaths, given the variant, the higher viral load, the higher transmissibility, and so on. It's a very desperate situation for a country like ours and many others around the globe that don't have huge pockets. Now, given this and the fact that we knew the vaccine was on the go, several very promising candidates were showing themselves up as early as 6 months ago. We would have expected the government to have gone into bilateral agreements with a number of these companies, particularly those companies which are producing vaccines which can be stored at refrigerator level, normal fridge temperatures. Now, they didn't. Why? We're rather clueless, but this borders on criminal neglect, given our adverse situation. So we have a really serious situation developing for countries like South Africa who haven't entered into bilaterals. We've seen 13% of the world's countries or population, rather, represented by states, snap up 51% of all global supplies. These are usually countries with the biggest pockets. Now, we do believe South Africa has the fiscal resilience and resources to have entered into agreements to get much more than what is presently promised. It's a question of South Africa doing too little, too late.
How soon, though, Rehad? I'm asking the question, how soon? I mean, April is seemingly seen as though it's too late, but of course there is just January, February, March. When exactly would you guys want to see it come?
Well, the question is of global supply. We've relied on big pharmaceuticals to provide this supply, and it's simply not good enough. The UN and 140 countries at the World Trade Organization in Geneva are pushing for equitable access to the vaccine, and this is critical. But the question is now the immediate task. The immediate task in our situation in particular is to get as much vaccine as possible. Now, we believe we could get 20, 30% of that if plans were accelerated, if the government, ended its denial of the scale of denial that we're seeing from them and accelerate their plans. Now, Johnson & Johnson, we know, are asking Aspen, a local manufacturer, to bottle and distribute this vaccine. Again, it's a one-shot. It can be stored at fridge levels. It's appropriate for our context and other contexts like ours. Now, why aren't those plans being made public? Why does this government not made public what the deal is with AstraZeneca and supply from India? Now, we need our frontline workers protected, our essential workers, our healthcare workers in particular, our teachers, if our schools are to reopen. The present plan, it would be, again, ludicrous to, I think, reopen schools without the vaccine in sight, without a date.
Yeah.
So the key thing is here to fight on many fronts, to break convention and appeal to people in those countries in the global north where these pharmaceuticals are based, to ensure that we have equal access. Because it's shown that if equal access is obtained, that we can eliminate the prospect of at least half of the deaths which are going to be coming if we don't have equal access to the vaccine.
Yeah.
This is a global threat and requires a global response, and our government needs to step up to the plate.
Most definitely.
But the reality is we've got money, we've got leverage, we are in a very difficult situation, the world knows it, and South Africa has to go do more than what it's doing at the moment at the World Trade Organization. Right. It has to enter into some bilaterals. So our vulnerable and, we've got a massive burden of disease with people with comorbidities in South Africa. We've got a huge health force. We've got 1,500 teachers have already died. We've got thousands of health workers that have already died. Our hospitals are on the face of collapse. So it's critical that a plan is developed. And what we're saying is, well, we're not actually relying. We cannot no longer rely simply on government. We need to come together in our numbers, in our various formations, with the Progressive Health Forum, with the Health Justice Initiative, with all the trade unions in the country, with all the civic bodies, and actually spell out what needs to be done, because our government at the moment seems to be dithering.
I'm just going to come in there. Rehad, thank you very much for your time this morning. That's Rehad Desai, of course, from the C19 People's Coalition, just essentially giving us their thoughts on the timing of this vaccine coming to South Africa. Now,